Millie Walk? Is that what it's called? Okay, y'all can tell I can't do anything but twerk. I'm joking, I can't do that again. Anyways, y'all, what's up? It's Desi from the Free Spirited Nurse. And finally, I'm coming to you guys to discuss my nursing journey. So this video was requested by you guys, and that's the reason why I'm doing it. I didn't think my nursing journey is that interesting, although it is a little different. But hey, you guys want to hear it? Let's go. So in high school, I joined this program called HOSA, and I think it stands for Health Occupation Student of America. And it is a program in high school for healthcare professionals, just kind of give them a little insight on what nurses and what doctors do in the hospital, just kind of give you an idea if that's where you want to go. So basically what you do, the first semester is all about like book work, and then after that, final class is just going to the hospital for a few hours out of the day, and you just shadow a nurse and see what they do. So it was pretty cool. So I started off at a community college, and so I did pretty well in my community college. I pretty much got on a dean's list, president's list, plenty of time. I think I graduated like a very high GPA, like a 3.9, 3.8, something like that, for my associate's in arts degree. So I did pretty well there, but just keep in mind that I got on very easily. So I didn't have to be in the books all day, every day when I was taking my prerequisites for nursing. I was pretty much listened in class, got it, and went about my way. So I did pretty well for my 2-year degree. So then I got into nursing school. Before I got into nursing school, everybody was like, oh my gosh, nursing school is so tough. And me, I'm just like, whatever, I'm smart. It ain't gonna be tough. So I never really listened to anybody. So I got into nursing program. I got called to go to University of West Florida, which is in Pensacola. And so I ended up going into the nursing program there. And let me tell y'all something. I thought my techniques of getting through school was going to work in nursing school, and it did not. So I went to UWF at first, and I basically was about to flunk out. Like, I was failing every last one of my classes with a D or an F. So rather than letting that go on my transcript, I decided to drop out of school. But I'm glad I went through that program, although I didn't finish, but it gave me a good idea of what nursing school is like, and what I need to get my act together, and I need to get better study techniques, and I need to get comfortable with reading a book, not just listening in class, and so on and so forth. So I took a little break, and then I decided to go to Florida A&M, and that's where I went for my bachelor's degree. I remember my mom dropping me off to school, and I made a pact to her that I was going to graduate spring of 2010, and that's exactly what I did. I remember when my mom dropped me off, she took me school supply shopping, and I got her folder, and I wrote 5 affirmations, but I just remember like 1 or 2 of them. One of them says, I am going to be a registered nurse, and I will not fail. I will graduate spring of 2010. And so I went to the nursing program with a whole different mindset, and honestly, I ate, sleep, and breathe nursing school, like no lie. So I basically lived in the library because I honestly realized I'm not the smartest person, and my techniques of studying before nursing school was totally not the way you should be studying. So I understand why I failed the first nursing program, but nonetheless, it didn't hold me back because I did get into a nursing school, and I was able to use my newly found study techniques at Florida A&M University, and I actually ended up passing, not with flying colors. There was times that I got C's, not many. I think I got maybe about 3 C's, 2 or 3 C's in the program, and the rest was A's and B's. So I did pretty average. I think my GPA graduating was a 2.95. So I know it wasn't competitive, but hey, I'm a nurse right now. Let's talk about my favorite subjects in nursing school. So my favorite subject was labor and delivery. I like everything about learning about it. But when I went into the hospital and saw a baby being delivered and saw a C-section, I knew it wasn't for me. But I was so infatuated, and still infatuated by what the woman's body can do, and how we reproduce, and how we snap back on top of that. So it was so interesting to me, but I knew I did not want to go into labor and delivery. So then after that, my next favorite subject was mental health. Mental health, I did not do so well in the book work, but I absolutely was drawn to the patients, and I loved clinicals. But it's crazy, that was actually one of my C's, but clinicals, I felt I belonged in mental health. It was so crazy. So, and those were my 2 favorite subjects in nursing school. Now, my not so favorite subject, I would say, was pediatrics. I always knew I did not want to go into peds. I love children. I think they're very cute, but they're just not for me, and I definitely don't like sick children. So I knew that pediatrics was not going to be my thing. So in nursing school, I enjoyed clinicals, even if it was in the hospital, because I was learning, and I do enjoy learning new things, learning new topics, and learning new skills. So Nursing school was actually, you know, the clinicals was actually fun, but one clinical that stood out to me was mental health, and I absolutely love it. But in nursing school, I knew that I wasn't going to be a bedside nurse for long, you know? I knew I had to get the experience, and I encourage everybody to get that experience, but I think it's always important to be honest with yourself and know what you want. And I'm a very headstrong woman, and I've always been that way, and I knew for sure that working bedside was not going to be a long-term thing for me, which is no problem. I just knew it was going to work. School. Okay, so in our nursing program, we had the ATI exams. ATI was our final exam, and it was our exit exam as well. So every semester we had to take the ATI, and if we didn't pass the ATI, we actually failed the class. So I studied my butt off every semester to successfully pass the ATI. Our exit exam, they gave us about a month off of school, 3 weeks to a month, I can't remember, to study. And I literally lived in the library studying for my ATI. So I ended up passing the ATI, ended up passing nursing school, was pinned, and then I graduated. Now time for the lovely NCLEX. So I went to school in Tallahassee, of course. I was living in South Florida, so I moved from Tallahassee to South Florida, and I wasn't even focused. I don't know what was my problem, but I was not even studying for the NCLEX. Like, I was just kind of just chilling. And then one day I received a call. Just keep in mind, I studied my butt off for the ATI exam, which is supposed to be a predictor exam for the NCLEX. So if you are successful in the ATI exam, then chances are you will be successful in the NCLEX. So I did pass my ATI exam, and I studied my butt off for that. Now, when it came to me finishing school, graduating and all that, I just didn't touch the book. I bought books to study, but I just didn't study. So one day I received a phone call from my friend Levon. Hey Levon. And he called and said, oh my gosh, I passed the NCLEX. And I was like, gosh, you passed? I think he called me on a Monday or Tuesday and said he passed. And I was like, well, if he can pass, I can pass too. I went online. I was so ignorant. I do not recommend anybody doing this. But I went online, went to the Person View website, and registered for a day to take my NCLEX. And guess what day it was? 2 days later. So I think he called me on a Tuesday. I cannot remember. He called me on a Tuesday, and then Wednesday I studied endocrine system only and test taking strategies. And on Thursday morning I was there taking the test. And like I said, I do not recommend anyone doing this. I put some earplugs in, and I was so focused. Now let's back up a little. Keep in mind, my thought process was, if I fail, I'll be able to take it again. I did not know if I failed, I would have to pay for it again, sit 45 days, and then be able to take it again. So I didn't know that, so I was very ignorant. When I say ignorance is bliss, listen to my story. So I went in and I took the NCLEX. Keep in mind, with barely any studying, I studied the endocrine system, like Addison disease, diabetes, what else? Cushing syndrome, you know, all the endocrine stuff, thyroid stuff. I remember studying that and don't even know and ask why. I think that was probably the area that I don't know why I chose to just study the endocrine system. And then I also studied test taking strategies. So, and then I went and took the exam, and I was so focused, I didn't look to the left, I didn't look to the right. I was so focused on taking this test. I remember having about 108 questions. And I went home, and I was online. You know, I know everybody knows about allnurses.com. I went on there and was trying to figure out how to know if you passed the NCLEX immediately. And I came across the Person View trick. And I'm like, oh my gosh. Y'all all know, anybody who took the NCLEX, although all over All Nurses and all the reviews you see says that the Person View trick actually works, you still don't trust it. So I went in to re-register, and guess what? It didn't allow me to register. I'm like, okay, well, maybe I passed. Anxiety level was still through the roof, so it didn't matter to me. I kept on doing the Person View trick over and over and over and over again, and it still never let me register. I still didn't get hyped. I still didn't get happy. Keep in mind, I took my test on a Thursday, so I had to wait till Friday, Saturday, Sunday, and then Monday for it to upload on the Florida Board of Nursing website. So I'm sitting here refreshing, even on the weekend where I know it's not going to upload on the Board of Nursing website. I was still refreshing. I slept with the laptop next to me, and I just refreshed. Even in the middle of the night where I know they are not putting in names, I was still refreshing. So I still, every single day, Thursday, Friday, Saturday, and Sunday, I kept on doing the Person View trick and going on the Florida Board of Nursing website. Doing the person View trick and then going on the Florida all weekend long. My anxiety was through the dang roof. Everybody say raise the roof. Hey. Okay, let me stop. Nonetheless, Monday morning came, and I refreshed, and lo and behold, Desi Donaldson, RN, with the license number, was sitting on the website. I was like, OMG, celebrate good time, come on. Yeah, I was so happy. And keep in mind, I'm the first college graduate in my family, so my family was so proud of me, like OMG. And I was extremely proud of myself, which I should be, because I failed nursing school the first time, where I dropped out of nursing school the first time. And then the second time around, I made a pact to myself. And keep in mind, I was not smart. There was time that I almost failed in nursing school. But I eat, slept, and breathed in nursing school. And I didn't allow myself to fail. Failure was not an option for me. And I think that was one of my affirmations, by the way. So, ended up passing, and I was so excited. Like, can you blame me? Like, seriously, first college graduate, and I passed the NCLEX on the first try with barely any studying. But let's scratch that. Keep in mind, I studied for the ATI. I studied my butt off for the ATI. So when it came time for me to take the NCLEX, I felt like I was well prepared, to be honest. Nonetheless, I did have 108 questions. Some people say, oh, you should have got 75. I passed. It doesn't matter. 108 questions, 275 questions, 75 questions. Doesn't matter. I still passed, and I'm a registered nurse today. So that's my story about that. So after becoming a registered nurse, finding a job as a new grad, before I even took the NCLEX, I applied to a bunch of jobs because everyone was saying, you know, try to get in where you fit in. So I applied all over. Like, I was willing to relocate as well. And I knew my first job, according to what everyone was telling me, had to be in the hospital. So I applied all over the US, and mainly South Florida, because I was planning on going back to South Florida. This was even before I took my NCLEX. So I was applying to hospital jobs only because I knew I had to work in the hospital first to become successful in nursing. So I applied to every last hospital. I applied to 2 mental health jobs, and guess who called me? Both of them called me. But I did not go for the interview because I knew you have to be a hospital nurse first. So that kept playing in my ear, that everybody kept telling me you have to work in a hospital first before to be successful in nursing. So I turned down both interviews. So I got home, took the NCLEX, passed the NCLEX, still was having a hard time landing a job in the hospital. I applied to every new grad program. So then I was having a hard time finding a job. So I went to Walmart one night and I met up with a friend, Belly. Hey Belly. So I met up with Belly and he was like, Desi, have you landed a job yet? I'm like, no. He told me he worked in chemical dependency, which was with addicts, helping people get off of drugs and alcohol. So he was like, and they hire nurses, so go ahead and apply and put my name on there, say I sent you. That night I got home, it was after midnight, I applied, put his name on there. The next morning, ring-a-ding-a-ling-ling-ling-ling-ling. And I got in for interviews. So I'm the queen of interviews and I shut them all down. One day I'm gonna make a video about interview skills because I think I got it. I never been turned down from a job. So I went in for that interview and yeah, I got the job. The week later, I was working as a chemical dependency registered nurse. So everybody know chemical dependency falls under mental health. I just feel like mental health was my calling because every time I tried to run away from it, I ended up right back in mental health. So I worked chemical dependency for about 2 years, and y'all, I absolutely loved my job. I love chemical dependency. I was an atypical nurse. I did not have to wear scrubs, and it was everything I wanted. Like, keep in mind, I told you I never really liked bedside. I knew that was something I did not want to do. So, but I knew I had to do bedside to get to where I wanted to be. So I worked there for 2 years and I absolutely loved it. Learned so much about addicts, and the judgment of addicts disappeared. Like, I used to be so judgmental, like, why are you on drugs? Why aren't you getting off? Like, why are you even doing this to yourself? Until I worked that job, and it honestly, working mental health made me the person I am today. I'm so less judgmental, way more understanding. So I know any mental health nurse out there can actually relate to what I'm saying, because we become more insightful about people and behaviors and why they are the way they are today. So I absolutely love mental health. So fast forward, I worked there for about 2.5 years, and I knew that I had to work in a hospital. So, and I knew I wanted to leave Florida. So I came to visit DC, and I absolutely love it. And I was like, you know, I want to move here. I knew I was not leaving Florida going into another mental health job, because I knew my eyes was on the prize for me to work in the hospital and get some bedside experience. So I'm gonna share that story. So I applied to jobs all over. I knew I wanted to move to Texas or DC. So I applied to 2 jobs in DC and 1 million jobs in Texas, all hospital jobs. And I applied to 2 jobs in the DMV area. DMV stands for DC, Maryland, and Virginia. So 1 in DC and then 1 in Maryland is where I applied for. And I interviewed for both. I interviewed both of them on the same day because I had to fly up. My mommy came with me. But yeah, I had to fly up. So I interviewed for both on the same day, and I got offers for both. But I ended up choosing the job in Maryland. I actually got hired for a new grad program. Although I worked as a psych nurse for about 2.5 years at the time, they still put me in a new grad program, which I really appreciated. But I had to sign a 3-year contract saying that if I leave within 3 years, I would have to pay them $3,500. I was like, yeah, I'm not leaving in 3 years. I can get 3 years of bedside experience. I know I'm gonna like it. So yeah, I ended up going through that new grad program, and I'm so appreciative of the new grad program. And although it's not required, I fully recommend anyone to go into a new grad program, because it's like going through nursing school all over again, but it's specific to your unit. It's catered to you. Like, you learn so much. They put you in EKG classes, CPR classes, you get your ACLS at the time, and the hospital is fully funding that for you, so you don't have to pay for it. It's a really good program, and you get one-on-one mentoring, and it's bomb. So if anybody can get into a new grad program, although my advice is get in where you can fit in, and if you can't get into a new grad program, most people don't start a new grad program, so it's totally fine. But if you can, definitely try to get into a new grad program. It is thebomb.com and highly recommended by me. Yeah, I went through a lot of training, and then I started working on the hospital floor. I worked on the cardiac tele unit, which is basically med-surg with cardiac. With a lot of cardiac patients, but we get just as much med-surg patients on that unit. So it was all going good, and every day I was going there, I was learning a lot, so I really enjoyed learning it. It was a very tough hospital to work at, but I was learning a lot, and so I liked it. But as days gone by, I started liking it less, and I'm the type of person, I need to be happy in everything I do, and my happiness level in the hospital started to decrease. At that time I realized, in addition to everything else that was going on, I didn't like bedside nursing. I really didn't. So I worked bedside nursing for just about a year, and then I went into home health. And I left, and I'm so grateful because they never asked for that $3,000. I broke my contract, ended up leaving with 1 year experience. And they never came and asked me for that $3,500, which I was willing to pay, because when I left bedside nursing, I went into home health. My pay increased $30,000 more annually. $30,000, ching ching, like seriously. And so before I left the hospital, I was like, this cannot be life. I cannot see myself working in the hospital for the rest of my life. Like, I was like, this is not anything I would ever want to do. Like, I did not like it at all. I mean, I enjoyed learning, but long term, I didn't see myself being happy there. Like, I remember going to work being sad and down, and I just wasn't my bubbly self. So I ended up applying for grad school while I was working in the hospital. And then I ended up switching my job and working in home health. When I got in home health, I absolutely loved it. That I regret going back to school for my NP. And I was like, dang, if I was working home health, I would never have applied to NP school. But nonetheless, I'm not a quitter, so I was like, all right, let's do it. I went through NP school while working home health, and throughout the whole thing, I absolutely loved it. So towards the end of nursing school, we had to do clinicals. Clinicals was another full-time job. I worked 3 jobs at the time because I needed to go PRN. So I worked in a hospital as a mental health nurse on a mental health unit, and I worked 2 home health jobs. So it allowed me to be flexible for clinicals, because clinicals was also full-time. Like, I was in glee at that moment, because it was 2 areas of nursing that I thoroughly loved. I thoroughly loved home health, and I thoroughly loved mental health. So I was not pressed. I finished nursing NP school, and I was impressed to find a job or anything, because I really loved the 2 jobs that I was working. So let me go back and talk a little bit about NP school. So nurse practitioner school it's a different stressor, but it was nowhere near as stressful as getting my BSN. I made it through with 2 B's and all A's. I graduated magna cum laude, and I did pretty well in grad school. So I don't really have any concerns. I would just tell anybody who wants to be a nurse practitioner, if this is something that you want to do, then definitely go back. It's definitely not as stressful as BSN school. I feel like if you can be a bachelor's, you can get your bachelor's, then you can get your master's. But it has to be something that you want to do, because being a nurse practitioner, you have a lot of autonomy and you are basically the final say. Like, you make the diagnosis, you prescribe the medication. You have to be comfortable with autonomy, being independent, and not relying on a doctor. And if that's not for you, it's not for you. You don't have to be a nurse practitioner if you don't want to. So I finished nurse practitioner school, and at 29 years old, and I was on these timelines for some reason. I felt like I had to finish school, be a nurse practitioner, pass my boards, buy a house, and have a husband by the age of 30 years old. I put so much pressure on myself to try to meet these deadlines on this timeline. Don't ask why I did that, because until this day I still don't know why I was doing that. But nonetheless, I ended up failing my nursing board the first time around because I was so pressed and pressured to take it. Like, I studied for about a week or 2 weeks and I went ahead to take it. I guess I was trying to do what I did for my NCLEX, but that didn't work because I did not have an exit exam for the program that I went through. Oh, by the way, I went through Walden University for my nurse practitioner. It was creeping up to my 30th birthday, and that's when I was like, forget these timelines. I'm gonna do things on my terms from now on. So my 30th birthday was coming up. I was throwing a big party. Nonetheless, I remember after I failed my exam, I was just like, why am I putting so much pressure on myself? From this day on, I'm doing everything on my own terms. So I had my 30th birthday party, flew out to Thailand, which is my favorite city, had a blast, and I came back in peace. And I still took my time, but I was like, all right, time for me to take it. So I finally paid for the board. I was way more relaxed at this time, chose my date, and I studied for about 1 month. I was studying 8+ hours every single day. Second time around, I ended up passing my exam May 31st, 2016, with flying colors. So by that time, May, I became a nurse practitioner. I was so happy about that. And I didn't land a job till September, only because I was comfortable. I only interviewed for one position as a nurse practitioner, and I landed that job. But only reason why I didn't get a job until September is because I absolutely loved what I was doing as an RN. I wasn't pressed to go looking for jobs or anything, so I definitely just took my time. And then, so for me, obtaining a job as a nurse practitioner was not difficult at all. And I understand it is tough out there to get a job as a nurse practitioner. I'm just sharing my experience. It wasn't tough for me at all. When I did my clinicals for nurse practitioner, I was ready. I was hands-on. I was ready. Let me do this. Let me do that. Let me write this script. Let me check this blood pressure. Let me do this IND. Let me do, I was ready. So I wasn't fearful of anything. So by the time I finished my clinicals as a nurse practitioner, I felt well prepared to practice. And then taken to what I learned in home health in the hospital all together, and what I learned in the book, and my personality of always researching, listening to podcasts for diagnosis, reading books, looking at YouTube videos, and always asking questions, and always collaborating with physicians, and always asking my fellow nurse practitioners for assistance, and asking questions and being curious has prepared me to be the nurse practitioner that I am today. So to end my story, currently I am working as a family nurse practitioner. I work for an amazing insurance company. I do home care as a nurse practitioner, and I absolutely love it. This is my second job as a nurse practitioner, and I don't think I'm going anywhere because I love what I do. And y'all know I love mental health as well. So as of 2 days ago, let me tell y'all the dates. So as of June 5th, I got accepted to a university to obtain my mental health nurse practitioner. So I'm super excited about that. I will be starting that program in January 2020. So my story is definitely unique because I did not start off as a bedside nurse. I started off as a psych nurse. I then, almost 3 years later, I went back and started working bedside. I only have 1 year of bedside experience, and I'm still a nurse practitioner, and a good one at that. So nonetheless, I would say march to the beat of your own drum. Everybody's journey is unique, so make it unique to you. You don't have to follow everyone else who did it this way. You can do it your own way. You are an individual, but follow your own path. Don't ever let anybody tell you that you can't do this and you can't do that, or you need this amount of experience. I think it's all individualized and it depends on the person. All right, thank you so much for tuning in to my video. Hope you guys enjoyed this video and you got a lot of insight and you enjoyed my nursing journey. Feel free to like, comment, subscribe to my YouTube channel, which is The Free Spirited Nurse. Make sure you're following me here on Instagram. And yeah, thank you so much for tuning in. Deuces.